Hello, my name's Patty Enrado from HIMSS, and welcome to today's webinar. Thank you for taking the time to be here. We have an exciting program for you, but before we get started, I'd like to highlight a few things so you know how to participate in today's event. At the bottom of your screen are multiple application engagement tools you can use. All the engagement tools are resizable and movable, so feel free to move them around to get the most out of your desktop space. If you need technical support during today's event, click the question mark icon in the navigation menu at the bottom of your screen to find answers to frequently asked questions, or you can type your questions in the Q&A widget to the right of the media player. You can use the same box to submit questions to the speakers at any time, and if we don't get to all of your questions today, we'll follow up with you offline. Engage with today's content and let us know how you're feeling with the emoji reactions. If you miss anything, don't worry, you'll receive an email within 24 hours with a link to the on-demand recording when it becomes available. So now let's get started with our program, Transforming the Patient Journey with Connected Experience. In today's fast-paced healthcare environment, patient expectations are higher than ever. They want care that is not only high quality, but also seamless, personalized, and accessible at all times. Today, we're going to explore how we can transform the patient journey through a connected patient experience. Our speakers today are Kenny Bloxham, Global Healthcare CX Director for WebEx by Cisco, Amy Triana, Division Director, Patient Access for Lee Health, and Rob Havasi, Senior Director, Informatics Strategy at HIMSS. Welcome to you all.
Thank you. Hi, Pastor.
Thank you, Patty.
So before we begin with our questions, I'd like the panelists to talk a little bit about themselves. So Kenny, why don't we start with you?
Yeah, hi, Patty. It's Kenny. I am, as you said, the Global Healthcare CX Director for WebEx by Cisco. I work out the UK, but work across all regions, and Americas is one of the regions what I do. Been in healthcare now for 12 years, and patient engagement, is close to my heart. I'm looking forward to speak more about the subject in the next sort of 30 minutes to an hour. Thanks.
Okay. Amy?
Patty, I am Amy Triana, and I am the Division Director of Patient Access for Lee Health. I've been with the organization for 16 years. I oversee 5 contact centers and 8 frontline registration areas. So it's pretty busy, but my FTE count for my contact center side is about 213 total. So I'm looking forward to this conversation for the next, like Kenny said, half hour to an hour.
Great. And Rob?
Thanks, Patty. I'm Rob Havasi, the Senior Director for Informatics Strategy at HIMSS. I've been with HIMSS for about 10 years now. My focus is primarily on interoperability, connected health, and emerging technologies. I spent a few of those 10 years as the Executive Director of the Personal Connected Health Alliance here at HIMSS, focused exclusively on connected health and the patient journey outside of the hospital. And before that, I was with Mass General Brigham for a number of years as an applications architect.
Great. Thanks so much. So let's dive right in. Let's talk about personalized engagement in healthcare. What does it truly mean, and why is it so important?
I think for me, Patty, it's ensuring that we don't have a one size fits all approach, and it is completely sort of patient centered, patient centered care, and that's not just about the clinical care that the patient receive, but also the care around that clinical aspect as well, and that includes everything from communication, making sure we have the right channels for the right patients at the right time, making sure that they can speak to a human when they need to, but also as well understanding where they are in similar levels of patient activation. And for me, this diagram probably really does typify, the complexity that we have. First of all, not just in actually driving engagement, but also driving, engagement personalized to a patient, because it is complex and it is difficult, because some pathways, have 35 to 40 different touch points, and that's proactive and reactive. So what we try to do is really actually look at, well, how do we put the patient in the center? What's important to them? And what is important is obviously patient engagement, patient satisfaction, patient experience. But I also, talk about this thing called patient activation, which, everybody, will know about. But, that is essentially the skill, knowledge, and confidence for me, being able to manage, my condition or my overall health. And I think if we can align that engaged, personalized approach, so how activated I am, in my levels of activation. I think what we will start to see, is improvements in outcomes, more satisfied patients, lowering costs as well, and it then, as patients feel, more empowered, we're then moving into, more greater preventative care as well, because patients, are actually, understanding before they actually get ill that they actually need to do something, maybe about some conditions that they're experiencing. And again, this diagram is complex. There's lots of different touch points, right through from access to appointments, all the way to, to the revenue cycle. But it is really about how do we actually, personalize that journey for the patient using the tools that we've got today, but whilst ensuring that it's right for the patient and it is their choice in terms of how they actually want to engage with healthcare providers. I don't know if Rob or Amy had any thoughts as well around that.
Sure. Thank you, Kenny. I'll throw something in here if you don't mind. I think it's terribly important, Patty, because when you think of patients, patients exist on a spectrum at any moment in time, from wellness to sickness, from their health, where their health may be taking a backseat to other things that are making their lives busy, and sometimes their health is front and center. And it's important to be with them at any point on that journey and give them the experience that lets them engage at whatever level they need at any time. So I think Kenny hit some highlights here, and I know Amy has some important things to probably add to that. But just remembering that patients are at a different level, almost varying every minute of every day and throughout their lives, and being with them is important.
I echo every single point that both Kenny and Rob made, because it is 100% true. And, again, it does go back starting with that digital front door, for the patients and having access to care.
Thank you all. So with the rise of digital health tools and apps, are we potentially widening the digital divide? How can introducing digital tools benefit all patients equally?
I think to, ensure that we all have the digital tools for all the patients equally, there's things that we need to consider, for that patient. And one is going to be accessibility, right? How they can have access to creating the tools on an individual basis. The affordability, I say that in the realm of, having access to Wi-Fi or, where they get that, whether it be at home or in an office setting, however they need to get that. Education and training is key for these patients to have that access for digital tools, because without that, they're not going to know how to function within that. So making sure that they're provided the tools for education and training and where that comes from. Because again, the digital world today is not the same as it was, 20 years ago. And I think partnering with your community too, because there's so many community resources that can help us with that education and training, with getting access to Wi-Fi, with, the accessibility piece. But I think the tailoring of that is also important because, of course, geographically and where you're at. And then taking all of those factors into consideration benefits not only the patient just digitally, but widens it throughout the rest of any other organization when it comes to access to those digital tools.
I just have one really quick question. You talked about partnering with the community, having the community help out. So as a healthcare provider, it's important for them to reach out and partner with the community to help, with the patient care or with patient education and understanding and access.
It is. And we at Lee Health, we do that. We have a community physician relations team. And then we also have a community team that is located in one of our site locations that patients or employees can go directly to, or we reach out to them and do it via either WebEx or Zoom or other ways to give them training on different tools and access.
I think it's, just to jump in, I think it's, Amy hits on, really important note in terms of actually including patients, in these, sort of care pathways that we're building out, which are face-to-face and digital and merged at the time. So, I think service design, and ensuring that patients are involved in that service design of how that care pathway, is actually going to be implemented is really critical. And if we do that, then we should get to a position where when we do deliver, a digital health solution, it is, accessible and also designed for all patient cohorts. And then we're not going to get this digital divide, that maybe we see, at this moment in time.
I agree.
Great. So how can proactive engagement drive a shift towards preventative healthcare and support broader population health goals?
I think that might come to me again. But proactive engagement is obviously something that, we do every day, across the patient's pathway. I think if we start to look at it from a preventative perspective, for me, proactive engagement from a preventive perspective, is about actually reaching patients before they actually do have a health issue. Rather than waiting for them to seek care, that sort of curative care, is about actually trying to engage patients, before they actually, do need, the complete care from an illness perspective. And I think there's probably 3 or 4 different, strategies. One obviously is, we're all subject to, cancer screening at some point in our lives, whether that is for bowel cancer, whether that's for breast cancer. So I think making sure that, patients, do adhere to those screening programs, that we're all asked to do is important. Secondly, how can we, with patients that are on a chronic care condition, give them the right tools to actually be able to monitor, their condition. I have ABD, so I have a chronic condition myself. I know when I'm going to get a flare up before I get a flare up. So it's being able to give the patient, the knowledge and the education, the confidence, like I said before, is to actually recognise that, but also then giving them the tools. And I think as we actually also move into, this era of AI and data, which, we are going to obviously, we getting them and are moving there. I think it's how we can actually start to use, that data, that we do have to actually start to do some really clever risk stratification and actually try and preempt, patients, or citizens, by certain geographics, certain demographics. One piece of work that we're doing in the UK today is we're working with a UK company that can predict whether a patient is going to show for their appointment or not. And that, if you don't show for your appointments, that can also sometimes mean that you're not actually compliant against your overall care plan. So the work that we're doing, and we're actually deployed now in NHS Trust doing this, is we'll be able to predict whether Kenny Bloxham is actually going to attend this appointment. And with that prediction, we've then actually built the ability to then start to personalise, that outreach, and whether that is your different channel of choice, whether that is the different point in time before that appointment, and maybe that's a different type of message or template. So I think, data-driven risk stratification, is something that can certainly support around, preventative healthcare. And then finally, I think, preference for personalisation. Let's not understate, we use smartphones every day, in our lives, and what we're doing today, and what we want to do with healthcare, we're doing in banking, we're doing in logistics, we're doing in retail. So why can't we use that type of technology, within healthcare as well? But obviously, what is important is making sure when I put the tools in the hand, and it is digital first or digital by choice, that we have that human, side, and making sure that we can always go to human if we need to. I don't know if Rob has a view on this at all.
Yeah, thank you, Kenny. I think there's a couple of thoughts that come to mind, and this question really ties up what both you and Amy said in the previous questions as well. There is a divide, Patty. You asked that question. Amy talked so well about the divide that patients are facing, but there's a divide that hospitals and providers are facing today too. Some are much better resourced than others. Some are sometimes struggling with their IT stack and just keeping the technology running. So being able to do what Kenny talked about, which is guide decision-making, which is particularly important for chronic diseases, right? To help people make better decisions, to lessen the exacerbation of their conditions, to give them a better quality of life, to reduce costs, all of the things we're trying to do in the quintuple aim and for other good reasons. require that kind of platform that has either a digital front door for people to walk through when they need it, an ability when something does get bad very quickly to reach out to a human and have that human touch that makes it work, but all in something that's affordable, regardless of whether you're a 2,000 bed multi-institution integrated delivery system or a small federally qualified health center just serving, a neighborhood or a small region. And being able to take advantage of cloud platforms are a big part of what CIOs use to overcome some of those resource divides on the provider side. Being able to take advantage of AI tools that vendors have integrated, to take advantage of other people's data to train those tools when maybe you don't have that much data yourself, or your data is not quite as accessible, or it would be very expensive to bring your own data forward, to still be able to get into the game and use some of those AI tools on cloud platforms are very critical right now for how most organizations are looking at both communications, patient journey, or actually all three, communications, patient journey, and the future use of AI.
Great. Thanks, Kenny and Rob. So how are patients responding to the increased use of digital and automated tools in their care journey? I think we spoke a little bit about that.
Yeah, I think I can maybe kick this off with some thoughts and going back even a couple of years and some data that HIMSS collected. So probably the first time we really took a deep look at how patients were adapting to a new technology that had sort of come forward very quickly was during the telemedicine boom around COVID. And all of the other technologies that went along with telemedicine, whether that was chatbots and machine learning, maybe not fully AI yet, but certainly other tools like that. We did a big study. It's still available on the HIMSS website. You can just Google telemedicine and HIMSS, and I'm sure you'll find it. It'll be one of the first things that comes up. I had a hypothesis when we started the study that we might see an economic stratification, getting back to that divide that you looked at. Some people preferring telemedicine, others preferring to go in person, maybe if they didn't have access to technology. We wondered if there was maybe an educational divide, et cetera. And what really jumped out at us is for telemedicine in particular, it was age. Age was really the only thing that stratified people, whether they preferred a digital first or a telemedicine experience, or they preferred an in-person visit or an appointment with a clinician. Generally, the older you were, the more you wanted an in-person visit. The younger you were, the more you wanted a digital visit. And even the youngest among them, Generation Z and the people coming right after them, the people who had just turned 18 and participated in our survey, they even went so far as to say they didn't even need video. They wanted a chat-first experience, right? They wanted to use their smartphones the way they use their smartphones for everything else. So surprising to me was that age really was the factor more than anything else. But along the way, at that time, we bumped into chatbots and machine learning and other tools, and their age was a little bit less of a preference, right? So once you got over, I want to interact with a clinician. There, again, age, you wanted it more in person. Younger, you wanted it more digital. But once you got into other tools, even that age stratification began to disappear. And people, as Kenny pointed out, often want to interact how they want to interact, depending on how acute their symptoms are. If I'm in pain, I probably want a human right now. If I'm just worried about something that on a disease I've been managing for a long time, I'll probably take a digital experience. But I do think we will see that age stratification continue for some time with some of these contact methods. And I know in some follow-up work we did very recently, we still see it.
Yeah. And I think patient choice is important there as well, Rob, I think, and being in healthcare for so long and, been, deploying patient engagement solutions for so long, across, all demographics, all age groups, it is interesting, patient behavior. Yeah. And I look at my mum and dad. My mum is, 67, MS, for the last 17 years, wheelchair bound, in bed by 6 o'clock in the evening. But she is so digital savvy. Yeah, she's got a WhatsApp, she's got a Facebook Messenger. Yeah, she'll do everything that she needs to do, and she could do it digitally. She would. Yeah. Whereas my dad's, just going to be 70 next year. Very much, sort of set in his ways. Would do face to face over digital. Why would I do a digital call? Digital video, session with GP when I can, go and have it face to face. So I think it is come down to patient choice as well. But I think what is really important is, we do let the patient decide, and offer the tools. And if the patient's comfortable, whether they're young, middle or old, then, let them decide.
I think, Kenny, I'll point out a subtlety in our data too that maybe I didn't mention, but you really reminded me of it. We asked about acceptance and preference, right? Which we found interesting. We did find acceptance across the board. There are lots of digitally enabled older people. But when we asked them to put a dollar value on a visit, how much would you pay for this? How much would you pay for that? Across the board, we found that the older you were, the more you would pay, or the more you valued and preferred that in-person visit. And I think there's all sorts of reasons for that, right? Older people, that's the way their healthcare expectations were anchored. It's the only way we went to the doctor 30 years ago, right? Whereas younger people, their expectations are anchored digitally, but that acceptance and preference was interesting.
I was just going to add into that also, Rob, is that it comes down to the cost too, right? Because COVID did open that up for us with the telehealth world. And so when we kind of are now on the back end of that, which some places are having ramps ups again of COVID, but patients still want that as an option. And so through COVID, it could have been one cost. And now that we're out of COVID, it's another cost. And so it's also, to your point, it does come about cost too, because quick appointment, those younger generation, they're going to say, okay, just get me out of telehealth. I'll pay the $25 or whatever it's going to be versus having to drive to an appointment, So again, I do think it comes down to the cost and the value of the care that you're going to get also, which should still be the same. However, that in-person versus technology is definitely a little bit of a difference.
Oh, that's fascinating. I think too, is as long as you give them choice, right? That's the important thing. So my next question is, how can we define and measure meaningful patient engagement to drive clear metrics and accountability for improvement?
I'm happy just to lean in initially if you want me to do that, I'm happy to do that. I think, the obvious metrics are, appointments attendance, follow-up, compliance, healthcare outcomes, and also obviously readmission rates. I think they're some of the key metrics, and I do come back to this, this patient activation, and there is something called the patient activation measure, which does measure, essentially how activated you are in your health or your chronic condition, as I've said, I think that's a great, sort of measurement that you could measure, before the care pathway to afterwards, and to see how that patient engagement does move, as they go through their care pathway. And I don't think, we do enough around patient activation measures, to actually really determine, how we do actually personalize that service, for that patient. But they might be my initial thoughts. Don't know if Rob and Amy have anything to add on to that.
And I was just going to add to that, you had mentioned, readmissions, right? So having patients come back into the hospital, having that option for them to submit that information, to review that information, is going to lower that chances of the readmission, because having them come in and being readmitted and staying in the hospitals, they're not happy, right? Nobody wants to be in the hospital, and regardless if they have a loved one sitting next to them or not, they're not engaged in that. And then that patient experience in some ways kind of just falls, because it's a different side. It's more the emotional and mental side of it then that they're experiencing. Isn't as good of an experience, where if they kept up and were trained and stayed technically involved in submitting this, it would lower those readmission rates, where patients would be healthier, they would be more proactive, and we would, as organizations, see a significant drop in that.
That totally makes sense. So burnout impacts not only physicians and nurses, but frontline workers and agent callers. So can one of you walk us through how AI, automation, and digital tools can realistically address burnout, reduce workloads, and support healthcare teams effectively? So Amy, you're in the front line, so
Yeah, I'll take that one. It is actually very important to me because I think, you know, even from a frontline perspective, we are seeing these patients who are tired. We are seeing these patients who are sick. We are seeing these patients who are continually coming in for the same thing. And at the same time, we as patients, either our own organizations or other places, are putting ourselves on the back burner because we want to take care of our patients. And so then we start to get burnt out. We start to get fatigued because we're not providing, we're previously not providing other options to our patients. And so, it to reduce that burnout, we need to streamline the processes and workflows that we currently create in our organizations, and with our technology. Because if we improve that, we improve the efficiency, and then we're also supporting our patients. Um, Part of doing that, I'm a huge proponent of, you know, workflows for administration too, because it needs to start with us to get it down to our frontline team members or our call center agents. Is we need to have that automated automation for leaders. It should start there because we need to be able to lessen some of that workload or have that automated for us to be able to make that a better experience for our teams too, because then that's one less thing for them. Um, Providing decision support is key too. I think, uh, we want to put in all these things and change all these things, but they also need to be supported by not only leadership, but decision support and training or decision trees, whatever, just to make it an easier process. Um, I think in collaboration too, because it can't just be me wanting to make the decisions for my frontline teams to help automate some of that stuff, but it not affect my call center people or the inpatient teams so that they're not, it needs to be system wide. Um, because if it's system wide, then again, those people that are going to be coming back into the hospital and taking up hospital beds, and those nurses are the ones that are turning on that. But if they had a more automated, streamlined process, it would be a better experience for them and the patient and would reduce them having to feel like they have to do so much charting and so much work manually. I think the other thing, and this is near and dear to my heart, is mental health. We need to really offer the support to our team from a mental health perspective, because oftentimes we're so busy doing the same thing because we're scared to change our workflows or automate our workflows or our processes. We're manually doing the same thing over and over again, and we just get overwhelmed. And so our teams need to have a mental health support. And then again, like I've referenced a couple of times, is really just prioritizing and continually updating workflows, because those workflows are what is going to make everyone's job easier and better and lessen the chance of burnout. And it can't start with just me as a primary stakeholder, right? Like, it needs to come from the C-suite. It needs to come from the providers. It needs to come from the tech side. It does truly need to be the collaboration of everyone, not just the one who's wanting to see the change.
I think a couple of things come to mind, Patty, and I'll try and see if I can string them into a coherent thought. In the earliest days of COVID, the European Union put out some requests for technology to help with the triage and the burden that was happening. And they used a specific phrase that has stuck with me for at least 4 years now. They said, "We're looking for cool technology that enables warm hands." Right? And I've always kept that in my mind. And I think it speaks exactly to what Amy had talked about and what Kenny's talking about. We have to envision the design for this next wave of technology in a way that keeps that phrase in mind. That what we're not trying to do is replace providers with AI, because patients value that human patient provider interaction, right? I'm hiring a professional to have empathy with me and to guide me through whatever my healthcare journey is, and then let me choose my path. And that brings to mind another quote from our recent AI summit at HIMSS. One of the largest vendors out there implementing AI in a number of places right now use this phrase, and it's kind of harsh, but I think it's important. So look, one of the things we've learned on the clinical side here is that you shouldn't try and gaslight your patients here. And they told a story about how they had implemented a chatbot that did some triage in a practice. And one of the product managers was visiting a practice and speaking with nurses there when a patient came by and said, look, I just wanted to say thank you to Samantha. When I called and I talked about my symptoms, she was very helpful in getting this appointment. And I really think we resolved something here today. And when that patient left, they looked at each other, and Samantha was the chatbot. And that gave everybody a bit of an uneasy feeling, right? And even a vendor, an AI forward vendor, said on stage, we're not here to gaslight your patients, right? And in those days of COVID, I talked to a couple of CIOs from companies that were putting those chatbots in the field, and they did some of their own A/B studies on the fly. And the one thing they discovered that points to something Kenny said too is once people are talking to their chatbot, they're okay talking to a chatbot, and they don't want it to be a pretend human. Once they're handed to an AI, or however that chatbot works, they want it to do computer things very efficiently, act like a computer. I need an appointment, pick one of these three, get it done, move on. So they can go back and have the human conversations with a human. So I think that's the key piece. We know providers around the world are worried about how AI is going to affect their practice. At HIMSS, we're of the opinion that, to use Amy's term, right, it's probably going to be augmented intelligence is really where we end up. We know that in Korea, they were so worried that doctors walked off the job and went on strike, worried that AI and some other factors were going to replace them. So we need to keep that in mind, that there's worry on the provider side, there's worry on the patient side. But if we can get that cool technology that enables warm hands right and design that, thinking about that from the beginning, I think we can get to that augmented world that can't always make everybody happy, but can make most people feel comfortable with where we are.
My next question is, why is connecting the care journey so important, and how do key system integrations improve care coordination across multidisciplinary teams? I know we talked about collaboration, so how is that, how do we connect the care journey?
I'll go ahead and start, and then if Robert Kenny want to jump in, again, this goes back to how important it is to all team members being connected to patient's care. In striving for the same goal, because if we don't all have the same goal, then it's just going to deviate, and then there's not going to be any collaboration and or care journey that's going to be efficient for the patient. And so I think, and you want it to happen seamlessly, right? You don't want all these little hiccups kind of happening at the same time, because then all that does is add more frustration to the patient. And so when you're working on those care journeys and that collaboration, you really gotta be efficient, but really effective in coordinating that coordination and care for them. Integrations play a key role in that. I mean, a huge piece, improving the coordination against multidisciplinary, having, frontline registrations and having call center settings. If I don't have a call center, I don't get the appointment scheduled for my front lines to be able to check in. So it really needs to start again. That care journey starts there for that patient, that first point of contact when I'm speaking to that patient over the phone from when they're checking in for their appointment. I will say a challenge that we face sometimes is the integration of different systems and getting those connected with each other. And so that takes time. But again, back to collaboration, back to having all the key, stakeholders in place. But by doing that, the hopes is that you reduce errors, you ensure that the patient's getting the best care because you've tailored it to that patient based on their care journey, preventing duplicate services potentially for the patient. And I think when you integrate them and you've connected them, you have one EMR system, one integration that's going to speak to each other. So they can be easily communicated with each other and tracked through progress by coordinating that care and in different specialties as well. So it's not just starting in one. There really needs to be a collaboration of all of it. And ultimately, it's just going to lead to a better outcome for the patient, a health outcome, as long as you are connecting that care journey, but starting at that point one.
Thank you, Amy. So, looking ahead, what emerging trends in patient engagement might shape healthcare in 2025, and what are you most excited about?
Who wants to go first?
Well, somebody's got to throw out the obligatory AI answer, because that has to be the answer to every question recently. So I'll start there, but then now it's your turn.
So for me, there's probably, I think there's two trends, and, they may go beyond 2025. But the first one is, we talk about personalized care. Yeah. As we still got, I think this conversation has highlighted, we still have some way to get there. Yeah. But I think hyper personalization, will happen in the future. And obviously AI, will support that and probably be the driver for that. And I think for me, once we start and be able to start to, augment together the patient's medical history, with behavioral, lifestyle, and social data, I think that's when we're really going to start getting to a position where we can actually drive personalization in healthcare. And that's where I think it will be hyper personalized. I think the second one, trend, is the social determinants of health. We talked a little bit about, home care and, about, patients, and citizens, looking after themselves, in their home, and some patients would find that a challenge. So I think that social determinants of healthcare is certainly going to start to blend into patient engagement. I think we're starting to see it in the US. We're starting to see organizations now who will take on the social care aspect, of the care package, including housing, including transportation and food security. So I'd say they're the two trends, that I see going into 2025 and maybe beyond.
I agree. And as an organization, we've started some of that now, like the hospital from home and virtual care and things like that, because again, patient engagement and having that ease for the patient. And, in future state, I would love to see not only with the whole AI, but, you just brought up like the grocery thing, right? Like I would love to see us having hotels on our sites, like place, because I think back, look at some of the care that some of these patients need, and their family members can't stay in with them, and they have to drive 50 miles away to stay at housing. Or I think we've just come so far. AI is going to be, like I said earlier, it's here, it's not going anywhere. I'm excited about it. And not for nothing, I'm going to throw this out there. I say by the time my grandson is 2, by the time my grandson is my age, we are going to be running in the Jetsons age. We're going back there. And I'm excited about that. I mean, that's my personal thought, but I'm excited about that because that just shows how much we are evolving and growing, and not just for patients, but life in general, right? Like that's what it's about, is it's continuing to grow and evolve, not just in healthcare, but in life. And I'm excited.
Yeah, I mean, it's hard to be the last in the chain here, because everybody's thrown out all the good ideas. So I'm gonna build on something Kenny said and take it from a slightly different wording, right? So he talked about hyper personalization. I've always thought about that as mass customization, right? I think maybe two sides of the same coin, maybe the same thing. We might be saying the same thing, but what I'm excited about mostly is we finally have a convergence. We have sort of, I think, the keystone, AI being the keystone. We've had the cloud bringing us ever cheaper computing power, so we can just throw more and more compute powered problems relatively affordably, right? We've had the growth of APIs and standards starting to mobilize data and make it a little bit easier. We're not really there yet, but we're better than we were before FHIR existed and before people started to embrace it. And then that was always great, but people would ask, when do you see the breakthrough? When does that really help patients? And my answer glibly was always, whenever AI is smart enough to finally bring all that together and deal with that giant volume of suddenly mobilized data. And then lo and behold, 18 months after ChatGPT broke into our consciousness, we feel like we're on the cusp of that. And so we get to the aspect that I think we started this conversation with, that with the right tools and enough computing power and enough integration, you can solve what healthcare is always looked at as the N of one problem, right? Which is, it's fine that this particular journey for this particular therapy or treatment or surgery or whatever gives the best outcomes for a population. And it's great that I know that. But when I suddenly need that surgery, I suddenly have an N of one problem. I only care about my outcome. And will my outcome be as good? And will my journey be as smooth? And the idea that we can hyper personalize or mass customize now that evidence-based therapy and wrap around it a hyper personalized sort of journey, that to me has always been the holy grail here, right? For what we're trying to do with technology, to make it seem like this whole system is built around me while still giving me the evidence-based care that I know we get because we've done it thousands of times over and over again and do it very well. So that's what I'm hopeful about. That and ChatGPT helps my daughter graduate college easier.
Rob, I don't know if you've seen that, but I definitely give you a heart on that one because that's so true. And yes, thank you for Chat GPT for accelerating that and helping in that. Yes.
Yeah, my daughter's 19. It's
happy graduation to your daughter. Happy graduation to her.
Great. So we've had a great conversation, and I just want to leave our audience with one key takeaway that you want them to come away with. So many great things were said today, but what's one key thing that you'd want the audience to come away with? And Amy, I'm going to start with you.
Perfect, because I was going to ask if I could go first. One thing that I'm gonna kind of take and really bring back to us that Rob said is you shouldn't gaslight your patients. Like, that was huge that he said that and hearing that, because I think as we are introducing chatbot and we're working with that and we're doing some of that's the perspective, right? And that was that when you said that, Rob, that really touched me and like made me look at things differently. And so, and even just that short moment, and it's still resonating with me. But outside of that, I think that we, with AI and what we're doing and how we're doing it, it is a must that we all collaborate and having all stakeholders in play and making sure, because again, if we want a great patient experience, not just I don't want to go for average, right? I don't want to go in and just get average care somewhere. So I think if we want to continue to have a great experience, we need to make sure that we have all key players and we're all collaborating together across our organizations, wherever that may be.
Great point, Amy. Yeah. I think from my side, Patty, I think, again, we've talked about patient choice, and to give patient choice and to get engaged patients, I think it comes down to proactive communications, offering self-serve where it's appropriate, but ensuring we got that human engagement as well. So it's proactive self-serve with human where it needs to be, or where the choice is.
Yeah, I guess, Patty and Amy, thank you for that quote. I had the privilege of moderating that seminar, and over 2 full days of talk, that's one of maybe 2 or 3 sentences that stuck in my head too. Patty, when I think about this, I'd say I want to remind people that this isn't going to be easy, probably not going to be cheap, but most things worth doing are usually neither of those either. So we're on the cusp of something great, I believe. I'm a techno-optimist. I probably wouldn't be in health informatics if I wasn't. But this idea that we can finally embrace the fact that most of us are patients, are on a patient journey our entire lives. Most of us today, at least in America, England, wherever, most of us are born in a somewhat medical situation, probably in a hospital. I know I was. Most of us will die there, even if we don't want to die there. We'd rather be home. Most of us will die in a medical situation. And everything in between is all part of that health journey that we have. And being able to design equity, put equity by design, as our Office of the National Coordinator, or ASTP now would say, or to build cool tech to enable warm hands to make those steps on that journey better. is finally more possible than I think it has been in the 15 years I've been doing this. So that would be my takeaway. It's going to be hard. It's going to require a lot of thought. It's going to require some good deal of money, but I think it's finally possible for us to really embrace this whole life patient journey and make it a bit easier on everyone.
Thank you. Those were all great key takeaways. That was a fantastic, I think, overall discussion. We're getting ready for our Q&A part, and I want to first remind everyone that you can continue to submit questions in the Q&A window to the right of the media player. We already have some questions here. So my first question that we have is, what are some examples of how new communication technologies have improved care access or minimized communication? Who would like to take that question?
I think, well, first of all, I'm happy to jump in. I think, Patty, I think COVID, certainly, accelerated, our access, to those tools. So I think video consultations, in, that COVID, when we had those lockdowns, were a godsend, for clinicians, and also as well, for patients. I do think it's a bit of a shame, that, they are still a little underutilized, I think, certainly from what I see, in the market. But again, that is about redesigning, pathways to include all of this technology, and just, not going, back to, face to face, but use the video technology, as a means, to ensure that we deliver the best care we can at the right time.
I think the only other thing I would add to that too is that, again, we refer to COVID a lot, but COVID is really what helped us step outside of our quote unquote comfort zones. And it's allowed us to really send our teams remote too. I mean, prior to that, we were able to, but it was not nearly as easy or an option to send teams remote. And so, sending teams remote, still being able to have all the functionalities that we have and still give them some comfort and peace of mind while they're still being able to work effectively and efficiently has increased employee engagement. But on the patient side, they haven't noticed the difference, right? So it opened us up as organizations and leaders to have that better employee engagement, but also to allow our patients to still keep that smooth transition and or maybe even on no understanding that we've went remotely. But that was huge for a lot of organizations, I think, across that came from COVID, because we didn't have that. I know people that I've spoke to, they didn't have remote teams before that. And I'll say, out of my 5 contact centers, one of them's got 79% remote, one of them's 100% remote, one's just right over 60, and one's at 30 because we just started. And it's huge. So I think that just helps add to that.
Yeah, Patty, I'll throw out 2, and I'll try and be quick about this. The first one is when pediatric practices in particular, they always understood there's an extended care team on the patient side as well, right? Because parents are always involved in care. And so pediatric practices are often the first to embrace that kind of integrated communication technology. You may have one parent who has to stay at work, right, just to keep the bills paid or whatever, while you have another parent who's in the room. You may have siblings, grandparents, other people who are interested. So recognizing that these technologies can also apply on the patient side of this to their care team is important. But you asked for a specific example, and I'm going to give you probably the most humbling informatics experience of my career in 30 seconds or less, if I can do it justice. We had enabled, in a pediatric unit, we had enabled communication and put workstations at home for our pediatric attending physicians, because they're always needed. They're often needed at night. And the drive back and forth was getting difficult. So we wanted to make sure they had contact. On one of the telemedicine carts, we put a camera so that it was pointed at something, either the patient or the family or the whoever, the residents, whoever was standing around the bed. And we struggled. And I remember several of us on the technology side struggled to help get vital signs into that workstation so that the clinician at home could get heart rate or pulse ox or whatever it was that he or she wanted. And that was solved not by my crack informatics friends and I, that was solved by a 12-year-old who one day, while the doctor was asking the resident at the bedside, what's the pulse, what's this, and asked this 3 or 4 times, and the kid said, can't you just point the camera at the monitor? So there's an example that it doesn't always have to be complex. We talked about stethoscopes that could capture waveforms and transmit those things. We talked about how we could screen share for the pulse ox or whatever, and the kid just said, point the camera at it. And as far as I know, that worked for years until, better technology came along. So one of the lessons and one of the examples is that it doesn't always have to be complex.
For sharing that, Rob. That's great, because that's a great point. I think a great takeaway too, that sometimes I think we make things complex, right? So we need to think more childlike, I guess I will say. Kudos to that child.
Being
Wonder
born
where he is
digital,
now. Right. We have another question here. How are organizations thinking about centralized digital access points to reduce the number of separate portals and logins patients must navigate? Do you have successful examples of a single unified healthcare platform?
That's a hard question.
That's the holy grail question right there.
That's the holy grail question. I was going to say, from a centralized standpoint of access, I could, speak to that. But as far as a platform, no, we're still using multiple. It's not a one single point of access. But we do strive, and again, an organization of our size, we really do try to centralize. And you get some people who like it, some people who don't, some providers who love it, some providers who say, I'll never do it. But again, understanding the why, getting their buy-in, showing, how it works, why it works. Because especially if they're seeing the same providers within the same organization, and, it just depends on what level you're going to. But as far as a platform, that's again, holy grail question.
I guess maybe an integration that seems seamless.
Yeah, it's difficult, and working out the UK and being a UK patient as well. We fall under the NHS. And it's quite interesting. The market in England at the moment, because the digital front door that NHS England want is the NHS app. That is digital front doors. And back in COVID, when we all had our vaccination certificates, they were in the NHS app. So we had 25 million patients, or citizens that were registered. But what then you've got underneath the NHS app, is all these other patient portals, at sort of provider level, or at hospital level, and it is that fragmentation. The only thing I would say is that what we have done is we've got a unified, NHS login. So you only need to have one login. So you could use your NHS app, you could use your portal for that provider, your portal for that provider, and it's the same login. But you've still got that fragmentation, and I certainly can't see, that sort of going away anytime soon. And I'd welcome the views from Rob, for Amy from a US perspective.
Yeah, I think one of the things we hear, everybody echoes what Amy said. For even an individual provider in the US, this is difficult to create that single digital front door when the systems behind may be fragmented. But Amy also said something I think is key that I want to make sure people heard well, which is that sometimes you can make it look seamless, even if it's a pretty hard lift on the back end to make that work. In the US, I'm so heartened to hear what you've been able to do with the NHS, right? In a fully integrated system, or let me say one single system, ideally, makes this easier. In the US, we're still struggling with the national health ID, right? Even if we could create a federated ID platform, we're still arguing about which IDs would be acceptable for healthcare and which wouldn't, which leads me to the problem that even where we have one primarily dominant vendor, right? Most of the biggest health systems in the US are on Epic right now, right? My daughter has to ask me, hey, Dad, you work in this. Why do I have to have 4 MyChart logins, right? They share data. When I log into my doctor's portal, it sees the vaccinations I had at CVS. I know they're sharing data, but why do I have to have different passwords for these? And until we sort of get our, health ID act together, we can't even reach the level that you've had success with in the NHS. So that's one of the places where we struggle.
That is the answer. I will put the gavel down on that one. That is definitely the answer.
Right. We're running up on time, but I do have a couple of questions still in our box. How do you see AI-driven virtual assistants impacting the patient journey in the near term, and what effect are they having on personalization today?
I think we've spoken quite a bit around personalization and AI and chatbots and virtual assistants. I think they're here. They're here to stay. It's now how we choose to use those across the patient journey. And I think we talked about those routine tasks. Those directing the patient appropriately to the right area, to the right contact center, to the right, health worker, it is going to be key. But again, as we said before, the innovation and the technology will enhance very, very quickly. So we've got to get, a quick understanding, I think, in terms of how we actually want to use these today, but also ensure we've got the foundations, for as they do grow. And also, again, as patients get used to the technology, they're going to want to do more and more with it. I think.
Yeah, we're definitely early on there, and I know Kenny's mentioned a couple times, but I also think that's a critical piece, right? Today, AI capability seems to roughly adhere to Moore's law, right? We double roughly every 18 or 20 something months as we can double the computing power we can put in a transistor. We don't know how much longer that's going to hold, but for as long as it does, that means we're doubling, in some cases, capacity or ability every 18 months or 2 years. And that means what our portals are and what our digital front doors are just 6, 9, 12, 18 months from now will be completely different than what they are today. So I don't think we're there for that personalization yet, but I think it'll come quicker than we might have thought even just a few years ago.
Okay. So we have another question, and I hope we can wrap this up soon afterwards. How can patient feedback drive transformation of healthcare services, particularly in how those services are accessed and delivered? Do you have any examples of feedback-driven improvements that have positively changed the way patients access or receive care?
I think that might be a good question for Amy.
Because it has a really long question and a really detailed question. So of course, patient feedback is key, right? We need to know how we're servicing our patients. How we get that across the organization, though, I think is sometimes where we struggle. Because again, right care, right time, right patient, first point of contact, one call resolution. You start thinking of those things. And so patient feedback is always going to be key, whether you're doing post survey, whether you're doing an email survey, however you're getting the information. But again, it's who we give that information to and what we do with that information. Because even though I can oversee 5 contact centers and get feedback from frontline registration, if I'm not doing anything with that information to help benefit the patient experience or their care journey, I'm not doing anything for the organization. And I'm becoming basically a hoarding ground for all that information. And so that's where, again, I say we need to escalate that information to the C-suites. We need to get our CIOs involved and things like that. So any real-time example, no, being newer into the AI feature and all of those things, patients love it. I know I love it when I utilize it and other things, but again, it's what we do with the information that we receive and not just cling on to it.
Yeah, and just to jump in there, Patty, I think it's what we do with the information, but it's also the type of feedback. And I think, yes, we can look at quantitative data all day long, but what about the qualitative data? What about the actual patient story? That is the key. Yeah, is what's the patient saying? We might give a rating, but what is the patient's feedback? From a narrative, from a feedback perspective, and that's really important because that's where the detail is. To be fair,
I guess I could give one example that I will say I'm proud that the organization does for us is when we do have that really good patient experience that starts at that that first entry point, or whether the contact center, whether it's sending a chat through my chart, or whatever the point of communication may be. We've had patients that will come and we will do 30 to 90-second segments, videos, or even news station broadcasts, whatever, with those patients, because that story can touch the rest of our community, and our community is what drives that. So to your point about quality versus quantity, if it's a good quality survey result, we want to get that out.
Yeah.
Great. Well, at this time, we have to wrap up. If we didn't get to your questions, we'll get to them offline. And thank you for a really wonderful presentation for our entire panel. We would like to thank our sponsor, Cisco, once again for their support of this webinar. So don't forget to take our brief evaluation at the conclusion of today's event and share your thoughts with us. As a reminder, you'll receive an email within 24 hours to rewatch the on-demand recording of today's session, and it will be available in the HIMSS Resource Hub for a limited time. So feel free to come back and watch it at any time. So thanks, everyone, and have a great day.